Hey friends, talking about some shoulder blade pain that is pretty common that can happen for a variety of reasons. Had someone ask about ways to improve some upper back knot type of pain. So let's talk about it first. We got a few things to address. It's going to be associated with the mechanics of your neck, your upper back, and your shoulder, with is also associated with your shoulder blade. And so kind of between the blade and the spine, we have our ribs running under, and then our shoulder blade is right on top. So ribs and shoulder blade. And so we got a lot of muscles happening there. So very commonly, we might get knots kind of in that space. And we can use a lot of things to help mobilize the joints for some good short-term relief, but then the long-term relief, prevent it from reoccurring from repeated activity, would work on improving the strength also of our upper back. But let's start with some feel good stuff. We're going to go through a couple pieces of equipment to address it. We will work with a foam roller. Hopefully yours is more flat and smooth than mine. Mine is like these killer daggers that hurt like hell, but that's okay. It works for me today. And then also the use of a ball called a fit ball, Pilates ball. It is a squishy-ish ball that we can also use for mobilization of the spine. So let's begin first with the foam roller, and then based on what you have, you can decide what works for you. So let's go first perpendicular to our body, foam roller into that upper back space. So keep your knees bent, and then you want to bring your ribs down. So our ribs here can flare up. Let's bring them down with your hands behind your head. You want it perpendicular across that tight space, and without even lowering your head, just bearing your weight a little bit more, you might already feel a couple joints open up in a form of a pop feeling or sound. And then keeping your neck long, just take your time. We're going to go through a couple different levels, so it's very arbitrary of like where you're putting it in your upper back. We're going to just go through a couple different levels. So for me, mine is right across my shoulder blades. And then to decide where you want it to go, you can move your body up higher so that roller is down just a level lower, and try again. So tighten up your stomach, ribs down, take your time, breathe into it. Do you feel anything sharp, right? That's just your body saying, hey, I'm not ready to go there yet. So breathe with it, take your time going up and down. If you start to feel better with repetitions, that's a good thing. If your pain and symptoms get worse with repetitions, that is not, right? So then this would not be for you. And honestly, you need to probably just seek more guidance from a health professional that can evaluate you, like a physical therapist. All right. And then find another level. So I'm going to go up one level higher on the roller, so that roller is one level lower. Okay. And then again, this is going to take me like very low in my thoracic spine. So take it right where my mid back starts to hit my low back. It's a tight area for me. So taking our time, keeping your neck long. Don't feel like you have to tilt your chin up, right? Keep your chin just pretty neutral here, and then down, right? Ooh. All right, so this mobilization is trying to translate our vertebrae on each other into extension. Hard surface with a foam roller. Softer surface would be with a fit ball, which I personally love. All right, but most people don't have this. So if you don't have this, then just fast forward over to the next segment. We'll go through the same thing. You can start up a little bit higher, kind of in the middle of our shoulder blades, and think about lengthen the spine. Stomach stays strong, so you're not overarching into your low back. You're trying to keep your low back supported and neutral as possible as you just isolate this extension, this movement in your upper spine only, and then return. And then again, a little adjustment of your body on the ball will then bring the ball down just one level lower. Inhale, exhale, and again, another adjustment down, right? Just working through our spine comfortably with our breathing. Definitely something that you can do if you find a spot. You can hang out here and breathe, but don't release where you feel compression and like your stomach pops up and everything is just now not supported and getting compressed, right? Opposite of our goals. We want to be supported. We want length in our body, length in our spine, not compression. All right. And then bring it in, coming up. So, mobilization of your vertebrae in your thoracic into what's called extension. So, this shape here using a foam roller and or a football. And then moving back to the foam roller, we're going to then have it be parallel with our body. All right. So, butt down, head down. So, if you have a 3 foot pretty standard longest foam roller out there available on the market, you should be able to lie like this. And then once you're here, you want to have your head supported, butt supported. Mine's just a little bit shorter. It's not a standard 36. And then you want to get your feet hip width apart. Check your spine. So before we get going, you want to bring your ribs down to the foam roller, tuck your tailbone low back down to the foam roller. So now there's effort here just to be here. We're going to use the foam roller to create movement now of our shoulder blades with our ribs with our spine. So here we go, straight elbows. Can you pull your shoulder blades back like you're squeezing into that foam roller? And then keep your arms straight. Let your shoulder blades glide away from the foam roller and then pull them back in. So you might feel those trigger points or those knots of the muscles between the spaces of your shoulder blades and spine and ribs, and that's good. 2 and 1. All right, so from here, we're going to bring them back in. We're going to split them apart, T-arms, open up your fingers. This will be your chest stretch. Chest stretch, right? So you don't have to touch the ground. If this is pretty good for you here, you feel that connective tissue stretch all the way across your arms and fingers, bring it right back in. Keep your spine flat, tuck that tailbone. Inhale, exhale. Maybe over time, you can go a little bit lower, but without changing the shape of your spine. 2. Love that feeling of this chest stretch. 1. So if you can, just let it stay here and relax your chest. 2 and 1. Bring it in. We're going to split our arms, one up, one down. So you can even do this with that football between your shoulder blades, one arm up, one arm down, creating that more gentle mobilization. 2 and 1. Right? So maybe roughly 5 or 10. And then here we're going to go out. So this one's definitely the most challenging one because it requires a good amount of flexibility in your chest. So listen to your body. Let's start with your arms hovering away from the floor. And then straight elbows, arms up by your ear. Straight elbows, bring your hands back in beside your hips. So squeeze into this armpit space when your arms comes to your side. And then lower your arms down just a little bit more if possible. Nothing sharp, nothing clunky, right? You decide on what your body can do. Keep your ribs in, back flat, right? So in the beginning, it's okay if you have your arms hovering the whole time because it is just tight. Over time, you'll be able to lengthen and bring your hands down to the ground. But no reason to push anything. You want a nice smooth transition through your shoulder joints as your arms move through this, what I call the angel arms. To overhead is always the hardest, right? So listen to your body there. A lot of times people will then start to float their hands up higher off the ground as they go overhead, and that's perfectly fine. You are just working within the range of your muscles associated with your shoulder. And then final. All right, so go ahead and bring it all the way in. Take your time, come off your foam roller or ball, and then we're going to go through just a couple more positions and maneuvers you can do to help further improve the movement of your neck with your mid back. So now they're going to work together in one piece. Open book rotation is my favorite. So bend your knees up high in line with your hips, straight arms, straight elbows, all the way open. Turn your head. So look at your hand. You want everything to comfortably move together. If you feel something sharp or stuck, you're just going to stop there and breathe and then return. And then keep your knees together. Don't let them separate. Inhale, open. Let your breath allow your spine to twist. Feel the stretch through the side of your body around your ribs, and then also the chest stretch across this arm that's opening up. And bring it all the way around. Woo. And then you're just going to then go into a half circle. So keep your knees again stacked up and over, straight arm, right? So you get the stretch all the way from underneath, around, turn your head again. Get that big chest stretch, hitting all the fibers of your pec muscle that goes from your chest into your arm. 2, inhale, open. Exhale, stretch up and around and in front and final. Oh, I love that feeling. Bring it all the way in. And we always have to hit the other side. So second side, you can just turn away if you'd like. And for visual purposes, I'm just going to flip onto my other side. You already know where we're headed. We'll do the 2 same moves here. Knees bent in line with your hips, straight arms, straight elbows, big rotation. So this is that open book. You might feel the joints in your spine open up in the form of a pop, and that is okay. Nothing sharp here. Keep the shoulders away from your ears. Let your neck move with your arm. You are going to be looking at your hand and inhale here. Exhale. Let gravity take it for a bit and then bring it in and then up and over. Here we go. So straight arm again, right? So you get all of this stretching through your side body and then turn your head just to what is comfortable. And then up and around and over. Breathing. And returning. 3 quality movements. And then bring it in. Alrighty, onto our stomach. This is it. This is your finale here. So you're going to be on your elbows. You're going to just let your chest pull forward, shoulder blades squeeze behind you. Right? So you're literally just sinking down. And then you're going to push through your elbows. Pull your shoulder blades away from your ear. Widen out your shoulder blades away from each other along your upper back, right? The widening out of our upper back. And then collapsing in and pressing away. That shoulder blade isolation, very similar to what we did in the beginning, lying on top of our foam roller, right? But now we are facing down, bearing weight through our arms. Can we still move these shoulder blades with the muscles connected to them? Squeeze them into each other, push them away. Final time, inhale. Exhale, you're going to push away, hold it here, lengthen out your neck like a really proud turtle coming out of its shell. And then can you turn one way and then the other? But you're driving those shoulder blades down, keeping your blades away from your ears. Bring your ribs in, stomach in. There's a lot of effort here in your upper spine, chest and shoulders, and creating length in your body as you let your head turn just to what you can without anything sharp. And then up we go. 4-point. Okay, we want a bonus move here to a little bit more active work because active is what's key to stop it from returning. Hands behind head, push your head back, lift your elbow up. You're going to rotate and stretch your chest. Keep pulling this elbow up, up, up from the squeeze of your shoulder blade and return. Rotate in, elbow, elbow, inhale. Exhale. And again, inhale. Exhale. 3 high quality moves. I feel like that's always good. And you got your other side, head back, so you have length in your neck, right? You want to create space. And then go ahead and rotate away. Lift your elbow, squeeze your blade back, come back in, elbow, elbow, and repeat. Inhale, exhale. So breathing is key. Making sure you're always breathing through. Two hands down, and we get to release, extend, and round. Stretch back and down. All right, go through that. Get more connected with your breathing, with your movement, more joints releasing and creating space, and overall just more flexibility with some mobility. We didn't do a ton of active work, but this is kind of like your initial movement to address the pain in the short term of trying to stop the pain from continuing, and then just a little bit of active work with that rotation at the end. So hopefully you find this helpful. Again, at any time you feel anything sharp and progressively worsening with movement, stop. It is not for you. It is really just for when we have these aches and pains that can just happen from a little bit too much activity, for example, exercising and doing more strength training, and or if we're very static and we spend too much time sitting and not moving a lot, our muscles will eventually create pain also because there's just not enough blood flow into the space. So for all those reasons, movement is always medicinal, and I hope that this helps you. Drop me some feedback if there's some other questions that you have in regards to what you're dealing with, and I'll see if I can create more videos for you guys. Thanks for joining in today. Hope this is helpful. See ya.